Amitabh Banerjee, our Professor Emeritus from Pune, the public health person, and he is the one you will find his videos very often, perhaps conveying a very important message on a particular topic. Dr. Amitabh, what you feel about this particular aspect?
Thank you, sir. Thank you, Dr. Agarwal. I am a public health person and I would see the larger picture. And as you
Yes.
rightly said, mentioned about the lady with the lamp, Florence Nightingale. She was the first one to focus on the hospital infections in the military wards. And she did a lot of work. In fact, she's done more epidemiologic work than most epidemiologists. She collected data and found many people were losing their life to hospital infections. Unfortunately, the trend continues today also. The focus is on the best surgeons, best specialists, best consultants, but the nursing staff down, the priorities are less. And actually, the hospital is a very complex system and every part counts. And perhaps the grassroots count more than the top when hospital infection control is concerned. Recently, only I think last week only, there is a big high profile case in Pune, liver transplant. Wonderful surgery done, but both the recipient and the donor both died, husband, wife. Very tragic case. And the best surgeons, the best facilities, and it was again due to infection, perhaps. I mean, the inquiry is going on. So we are not, and particularly I have seen in big corporate hospitals, they will hire the best consultants, they will pay them very highly, but the nursing staff downwards are not well looked after, and best of our nursing, competent nurses, they go abroad. And very makeshift arrangement is there for the auxiliary staff right up to the level of the safai walas because they are also important in hospital infection control and the safe hospital environment. I mean, there are sometimes fire hazards from time to time. Sometimes I was just seeing because this dog problem is in the limelight. I was seeing there have been instances every year we see an occasional instance of a dog carrying away newborn babies. I was just seeing in the web search 2022 Panipat, a dog carried away a baby. 2020 Godhra and Bankura. So these are because we are not paying attention to the grassroots level, understaffed uh, hospitals, say people in charge of the security. We may see, particularly in government hospital, dogs, cattle moving around in the veranda. So these are some of the hazards. And as a public health person, I was just thinking because we have been involved in a lot of factory inspections or food inspections at process. So there is those in public, and I think it's a concept which is there that is hazard analysis at critical control points. So when the hospital infection for safety is done or audit is done, one should visualize that at any point there may be a weakest link. What hazard can occur? Maybe it may be a fire hazard. There are instances where patients get killed in fire. There are instances of there is no fire exit, no fire precautions. These are the small things where medical profession misses out and which can cause big tragedies. And similarly, what are the critical control points? Are they, say, stray animals control or even the visitors because they carry the hospital infection? And it's a very complex, yeah, and I think we require a interdisciplinary from management, from human resource, and of course, medical expertise is one thing, and we are concentrating too much on the top-down approach. We should have a grassroots and bottoms-up approach, increase the staffing, and particularly in government hospitals, there are a lot of vacancies which are not filled of nurses, of technicians, of other paramedical medical people. So we require the leadership which can identify with the person to the lowest hospital staff because this is a, I mean, it's a, each one has to play its role and any weak link maybe at the lowest level can jeopardize the best of procedures, the best of operations. And then besides that, there are the food hygiene and other things. Besides that, there is the quality control of medication. So it's a very vast area. And like Murphy's law, anything which can go wrong can go wrong. That's all I have to say.
Thank you. Thank you, Dr. Amitabh. I always say one thing, Dr. Vijay Agarwal, that medicine is never 10 plus 10, 20. Sometimes it become 19, sometimes it become 21. But when you say, okay, it can be 10 plus 10, 19 or 21, I don't mind. But once it becomes 10 plus 10, 15 or 25, then you have to really see why it is happening, right? So that is where the entire framework of patient safety is being incorporated.